We are doing long-term positioning side lying. After you speak with your CI, you'll go to your patient and introduce yourself. Make sure that the bed is flat. After the bed is flattened, you'll position the hips and knees in a slight flexion. After that, you'll place a pillow under the neck and the head to help align with the trunk and to support neck lordosis. After that, you will adjust or slide the patient's shoulder and hip forward, the weight-bearing shoulder and hip forward. This is to decrease direct pressure on the acromion and the greater trochanter where the patient is weight-bearing. After that, you'll place a flat towel roll under the weight-bearing lower leg. This will be from above the lateral malleolus to below the head of the fibula. This is to support bony prominences and to decrease pressure on the lateral malleolus and head of fibula on the weight-bearing leg. Make sure that on your towel rolls, the patient is not touching the edges of the towel. Again, you'll place a flat towel roll under the weight-bearing lower leg. This is from above the lateral malleolus to below the head of the fibula. Again, this is to make sure that it decreases pressure on the lateral malleolus, which is the heel, the ankles, and the head of the fibula, under the weight-bearing leg. So make sure it's under the weight-bearing leg. After this, you'll place a pillow between knees and along the lower leg and foot. Again, you'll place the pillow between the knees and along the lower leg of the foot. This is to decrease pressure between the medial femoral condyles, medial malleoli, and feet. The next step is to check that the knee is level with the hip. After you check that the knee is level with the hip, and the reason for that is to decrease strain on the hip joint. After you check that the knee is level with the hip, you'll check the ankle position and support with extra pillows or towels if needed. Again, this is to make sure that the neutral position between inversion and eversion to prevent strain on the ligaments and the joint capsule. Okay. After that, you'll place a pillow against the trunk and tuck with sheets to hold. This is to assist with balance and trunk support. If you need to go to the other side, remember to put up the bed rail before you go on the other side. And you want to make sure that the pillow is tucked under the patient to help them with the back support and to help bear their weight.